Good afternoon, and thank you for joining the 2020 ASPPH Virtual Annual Meeting Session, COVID-19 and College Students. What you absolutely need to know. My name is Hala Madanat. I'm Director of the School of Public Health at San Diego State University, and I'm very happy to moderate this session. As we all know, the emergence of the novel coronavirus has turned our world upside down. Colleges are closing, we're practicing social distancing, and life as we know it is either canceled or happening virtually. Social media helps us stay connected with friends and family, but also perpetuates the spread of bad information. Today, we're going to cut through the noise to get the real information about what you need to know to stay healthy and grounded in these challenging times. It's my honor to introduce our speaker today, Dr. Nicholas Fentites, or Dr. Nick. He's a physician and our Chief Medical Officer for the San Diego County. Dr. Nick is an advocate for those in his community who need it most. For 9 years, Dr. Nick served as Chief Medical Officer of one of the largest network of community clinics in San Diego County. Ultimately, he took his advocacy into politics, serving as the publicly elected chairman of the Board for Palomar Pomerado Health, the largest public hospital in the district in California. Dr. Nick has served the last 11 years as the Chief Medical Officer for the County of San Diego, and for the last 13 years, he has also been the National Director of Health and Wellness for Exene Health Partners. Dr. Nick is the founding co-chair of San Diego County's Childhood Obesity Initiative, the chair of the San Diego County Childhood Obesity Task Force, and a board member of Palomar Pomerado Health System. He was on the executive board of the California Center for the Arts, Escondido County, and Escondido Board of the Healthcare Association of San Diego in the Imperial Counties, and physician chair of the medical board of the Council of Community Clinics. Dr. Nick's life story to address his own personal health needs and achieving an enduring transformation of his personal health has been featured in People magazine, Reader's Digest, Washington Post, New York Times, and on CNN, Fox News, Discovery Channel, and even the National Enquirer. Dr. Nick is a cancer survivor and has been to as many countries as he is old, and he is always willing to lend a helping hand where it is needed the most. So before I turn my time to Dr. Nick, I would like to remind all of you that you can ask questions in writing at any time during this session by clicking on the Q&A button on the bottom of your screen. I will hold questions until the presentation is finished. Now I turn the time to Dr. Nick. Thank you so much for being with us this afternoon.
Thank you, Hala. I totally appreciate it. And good afternoon to many and good morning to some of you. It is still morning here in San Diego, California, where I am. Thanks for the generous introduction. And I want to start by saying a few personal words and lay the context of what I'd like to share with you today. On purpose, I'm wearing a San Diego Padres tie because right at this minute, I had planned to be at opening day at Petco Park, but instead, I feel like I am now part of the Super Bowl of public health, so we have a different attention and focus to deal with. Fellow educational students, I want to tell you that it feels like yesterday that I was an undergraduate, that I was a graduate student doing my master's degree in public health, a medical student at UCSD School of Medicine getting my MD. Never in my wildest dreams could I have imagined that the path of life would lead me to where I am today, including, by the way, this opportunity to spend some time with you, an opportunity that I do not take lightly nor for granted. You know, as a physician who now serves as the Chief Medical Officer of San Diego County, I just want you to know a little bit about our region. San Diego is the 5th largest county in the country. We have 3.3 million people who live here. And as a result of my training in graduate school and undergrad mostly, I have to say, not as much in medical school, I now have what's called population health lens, in that I truly think of my patient as the 3.3 million people that live here in San Diego County. And those 3.3 million people represent 1% of America's population. And because the doors have opened up for me to practice medicine in the same community that I train, it's very interesting, because a lot of times I run into classmates at different meetings, at the medical society, at conferences and so forth, and I often run into them and we catch up and talk about what each other's doing, and I'm like, hey, Pete, what do you do? They're like, oh, I see 20 patients a day in my office. And Jane, what do you do? Oh, I do surgery on 5 or 6 people a day. Hey, Nick, what are you doing? I'm like, I take care of 1% of America. Come on now, we're doing serious stuff here. And I say that because I realized, and I heard as I was preparing for the conference call, that many of you are undergraduates that are still deciding what your future may hold. And I know that many of you on the call watching right now are actually graduate students in public health. And perhaps some of you are thinking about a career in medicine. Listen, folks, I heard this morning, and it was funny because I was on my way driving here, coming to you from what we call our Emergency Operations Center at the County of San Diego. I heard today that there are a lot of celebrities that are trying to put out PSAs. In my heart, I genuinely believe, and I had like an aha moment as I was driving here today, that the only celebrities in the country that I care about right now are people like Dr. Fauci, Dr. Collins, who runs the NIH, Dr. Jerome Adams, the Surgeon General. It is fascinating for me, and no disrespect to celebrities from Hollywood, but it is fascinating for me for the entire country to all of a sudden be focused on our physical health and population health well-being. And so just a quick little sidebar for those of you who are considering what you want to do with the rest of your lives. I consider you to join the force of highest calling and the family that is paying all of their attention on taking care of healing and protecting and treating the people in our community who need it the most. Having said that, and laid a little bit of a personal framework, I want to start off by also sharing something else which is very personal and very intimate for me, and that is the experience that I've been through as a physician, yes, but as more importantly a family member. And I'm doing this on purpose because it's going to come back to one of the key themes that I want to share with you today, and that is, what's the relevance of all of this to you? Why should you care? Why are we making such a big deal about this? You've heard that at your age, you know, this is not that big of a deal. So why is everybody like overblowing this thing, hyping it up and so forth? Folks, I will say there is a needle to be thread between spreading unnecessary concern and fear, but also taking meaningful, and what we are doing now, I can fairly say, is unprecedented action. And I will just say, before I come to my main point, and I'm no prophet, but I believe some things are going to be unfolding over the coming few days in parts of our country like New York City that are going to jolt this country and that are really going to raise the level of concern, if not panic, that I believe we'll be experiencing. And it relates to the whole issue and part of what I want to get to. But before I get into that, I want to share why this is so personal for me and why I am so passionate about this. We are currently experiencing a pandemic, okay? But this is not the first one that I have been through. The first pandemic that I experienced was literally within a month of me becoming the Chief Medical Officer of San Diego. That was in 2009, when we had our last pandemic, which ironically, by the way, actually started here in San Diego. The first case in the world was diagnosed here in San Diego, and that was the pandemic of H1N1, also known as swine flu. And as fate would have it, folks, the third person, literally, in the whole world to die from complications of H1N1 in 2009 was my own father, George Ephantidis. And part of my passion is to honor his legacy, but there's a deeper story to be told there in relationship to what we are about to embark on, and talk about what the relevance is of that to you. See, my father was advanced in age. At the time, he had just turned 70. He was pretty generally healthy. He did have some underlying medical conditions. And because the virus and that pandemic literally started here in San Diego, one of his grandchildren at that time, who was less than 10 years old, had an infection that nobody thought anything about. His symptoms were very mild. The 10-year-old grandson, it was no big deal. At that time, because it was so early in the course of events, we all just assumed that it was a common cold. Little did we know, within a few days, I was with my father in the emergency room, and I remember I had just become the the chief medical officer of San Diego County. And as I was standing around the hospital bed in the emergency room, watching my father gasping for air, I said to all the doctors and the nurses, folks, I'm very concerned that this could be H1N1. And I remember it wasn't disrespectful, but there was a little bit of cynicism, and they kind of blew me off like, yeah, Dr. Public Health Boy, we got this. Step back from the table. We know what we're doing. Well, wouldn't you know, 72 hours later, the lab results came back, and 2 days after that, my father retired into eternity. The moral of that story is a couple things. Number one, he got the illness from a family member. And that family member was young. That family member, one of his own grandchildren, did not have a very serious version of that infection, and he recovered from it without consequence. Now, that was a different virus than the one we are dealing with now. Once we figured out that it was an influenza virus, there was not the same reality that we are dealing with here that I want to explain and talk to you all about, because there are some distinctions. But the principle of how we take care of ourselves and the responsibility that I believe every one of you has to be good stewards of your own health and well-being, you need to realize that in this situation, it is not just about you. Much of what we are talking about here relates to the decisions that you make and the impact that they can have on other people. And I have nothing better to offer you than an illustration and an example that I have been through personally before in my life. I've seen this movie before. I've experienced it. And that is why the storm that rages inside of me is much bigger, in my opinion, than the storm that potentially we are going to be facing with this virus. So let me now transition, having laid some context for you all that I hope will enhance your receptivity to what I'm about to share, because I've always had an assumption that transparency breeds receptivity. And in today's polarized, opinionated world with trust deficiency syndrome, what I feel we need is authenticity and honesty. And I'm willing to offer that to you all for the time that we have together in this webinar. So let me take a step back and now take off my loving heart and primarily focus on my clinical mind and share some things with you from a clinical perspective. Folks, what's so interesting about this virus is that it is called a novel virus. It is in the category of what's known as the coronaviruses, but this specific virus that originated somewhere in Wuhan in December of 2019 is a virus that this world has never previously seen. And as a result of that, there are three important things to bear in mind. Number one, it is a virus that nobody has immunity to. Number two, it is a virus for which no vaccination and no preventive intervention exists. And number three, it is a virus for which we have no direct medical treatment. There are no drugs that are specific to this. There is no Tamiflu equivalent like we have for influenza. So bearing that in mind, that is why in some ways, honestly, and again, without an ounce of alarmism in my heart, I am convinced that we in the United States are about to experience something that we have never gone through before in modern history. What I tell my medical colleagues is that we are living and making history. And the reason for that is because the set of circumstances is so unique. And even though many scientists and individuals who are experts in things like epidemiology, this is the mother lode. This is the Super Bowl of public health that many have prepared their lifetime to face. And so because of those factors, I think of it in illustrative purposes almost like we are entering a war with a virus. But because of what I just told you, we don't have the weapons yet to fight it. And so the illustration that I've used with my family, especially for those of us that are on the front line, we are now hunkered down in the trenches. We are taking cover. All of the social distancing things that we are doing are designed to buy us some time and protect us from the enemy until the reinforcements come in terms of vaccines and treatments and all of those things. And if you understand that analogy, that is what's happening in America, is this concept of social distancing and the notion of the need that we have to hunker down, to hide in the trenches for a while, because we're not prepared to face this new enemy, this virus that we haven't been exposed to before. And that is where the dynamic currently exists that is so complicated, in that we as public health individuals all of a sudden have the authority. We've always had the authority, but nobody's paid attention to it before. We all of a sudden have the authority to make decisions that is rocking everybody's world. We are literally changing in the last 3 weeks the whole paradigm of what life in the United States looks like. But it is all designed to protect and to preserve the health and well-being of as many people as possible as we are all hunkered down in the trenches of our homes until some of those medical reinforcements and those skills are available to us. Besides the protection aspect, there is the element of also protecting the capacity of our hospitals and our healthcare delivery system to respond accordingly. That is what I'm so concerned about in terms of New York City, folks. I genuinely think in the next 72 hours, you will see unfold before your eyes the reality of what it looks like when all of a sudden a population of very many people living in a very dense area where viral transmission is occurring do not have the things in place to be able to respond to the disease accordingly. So, having said that, just a couple quick things. I know we have lots of questions, and I want to spend time responding to those. So just a couple more quick things. I want to share an analogy with you all. You're all familiar with what happens oftentimes on the East Coast and in the Gulf of Mexico and all of that in preparing for a hurricane, okay? In my mind, as a public health, population health official who is passionate about the 3.3 million people living here in San Diego that I love and care about and serve on a daily basis, that analogy fits perfectly. New York, they're a little bit further in the process, but let me quickly explain where we are here in San Diego. We are still in the eye of the storm, and everything that we are doing is to prepare. We talk about boarding up our windows on the East Coast. No, we are boarding up our people. And we are imploring those people, especially you, the invincible young college kids who feel like life's a charm and you don't realize what's at stake here. For example, not just about your health, but the impact that your decisions make on your loved ones and the vulnerable people who live around you. And so the decisions that we are making are all in the premise of the eye of the storm. And we're making tough decisions, folks, in order to protect public health. For the first time in my life, the decisions that we are making are destroying some people's economic security. From top to bottom, by the way. From people getting laid off to businessmen who are friends of mine, who are moguls in real estate and hotels who've had to lay off thousands of their employees because all of their properties are closed. That's the boarding up process. The storm is coming. And when the storm comes, hopefully with all the things that we are doing, we will be able to lessen its severity. That is my hope. That's what we're working on in San Diego, is to turn a Category 5 storm into a Category 3 storm that we can deal with. And then lastly will be the recovery. And folks, the recovery is going to be substantial. It's going to be economic. It's going to be emotional. It's going to be infrastructure recovery. And frankly, I think there are some amazing things happening right now in terms of us also having a whole new paradigm in terms of how we are delivering healthcare, the virtualization of the workforce, the telemedicine of medical care delivery, the Uberization and the Amazonification of lab testing. This crisis is going to lead to some incredible innovations that the tomorrow that we will get to will be better than the reality that we have today. But we have got to go from being pre-storm, through the storm, and to the recovery. And again, I had a lot of technical things that I was going to cover in terms of a number of cases and all that. You guys can find those things online. What's pertinent to me is the bigger picture here. And the message for all of you, I will boil down into three things. Number one, you still deciding what to do with your career? Join the true celebrity workforce, the healthcare workforce, the physicians, the nurses, the public health professionals, the researchers, the paramedics, the fire chiefs. Those are the celebrities in my heart that everybody is now turning to in facing this crisis. Number two, practically, you're not invincible. And you know what? 80%, and that includes probably most of you listening right now, you get infected, you'll be just fine. That's not what I'm concerned about. I'm concerned about, just like I shared the story of my own family, of one of you young invincibles not taking responsibility, exposing yourself to the virus, and then bringing it home or bringing it to a relative as a tragic gift that may make lifelong consequences. And thirdly, be informed, be aware, and live out your life in these days as an example. Be part of the solution, not part of the problem. Sorry if I came on too strong with my introductory comments. I just can't help myself. I've lived through this. I feel like I have been preparing a lifetime for this experience, and I am just so thankful to be part of a team here in San Diego that is so prepared, and if I may, locked and loaded and doing everything that we can to prepare to face this viral war head on. Hala, with that, I will pause my talking and turn it over to you, and I guess you will be sharing some questions with me. Thank you very, very much.
Thank you so much for your thoughts and sharing all of this with us. We do have a significant number of questions, and I'd like to start us with a couple that are probably really quick answer on your end, but I think are important for people since they came in a couple times. So what are we anticipating or predicting as the number of infections in the US?
Yeah, it's going to be significant. And folks, let me quickly say, and Hala, that's a quick question, but I'm going to illustrate this very quickly. If we lived in China, folks, you know what would have happened in the last few days? There would have been a barricade that would have been put around New York City. If we lived in China, you know what would likely be happening? There would be a barricade that would be put around New Orleans, perhaps around Seattle, perhaps if not now, pretty soon around San Francisco. As somebody who has volunteers from my faith community that do nothing but feed me tidbits of information because I'm so busy to be kept up to date, I am very concerned about what we're calling some of the hot spots in our country. The level of infectivity, Hala, is largely going to depend on how aggressive we are with these social distancing measures, not just at the local level, but at a national level. And I don't think it's classified. I think I saw this in the general media. There are discussions, folks, happening right now. The last time we did this was in 2001. Many of you were not born yet, of literally grounding all domestic airline flights. Because whereas we are a country where personal liberty takes precedence, there is still major concern of as the level of community transmission explodes in certain parts of the country, that we don't cede it by airplane flights to other parts of the country. So the answer to the question in terms of how far this infection is going to go is totally dependent on the areas of the country that are still in the eye of the storm and some national policy decisions that need to be made, and whether or not, even though it's going to be excruciating and very difficult economically, we're going to pull some further levers and do what we can to contain the infections. But I will say, by definition, a pandemic, and this is very oversimplified, a pandemic implies that the vast majority of people will experience exposure to the viral or infectious agent, whatever kind it is. And because of how easily this one transmits, I think the infectivity rate, especially if we continue to dilly-dally in some policy areas nationally, is going to be much higher than it should be.
One of the questions that came in from multiple people as well is, do you know if the virus can be contracted more than once?
Yeah. The question on whether or not a virus can be contracted more than once, or whether or not the virus, for example, you've had it and you have created immunity to it, we don't yet know. And let me quickly illustrate with two different kinds of viruses, okay? There is the measles virus, that even though it's not lifelong and we're all familiar about, I hope you're all familiar, have heard about what's happened in parts of the country I know is very controversial in New York, in California, of requiring vaccination for school entry and so on and so forth. You know, there are many viruses that we have vaccines for, right? And once you have those vaccines, whether it's a 1-round, 2-round, 3-round, or whatever, your immunity is for life. If you've been exposed and you had the infection, you're good to go, basically. There are some caveats in terms of how long immunity lasts for certain things. On the other hand, you've got the influenza virus, right? And what's different about the influenza virus? The influenza virus annually does a mutation and it changes, which is why every year we have to go through a fascinating process, fascinating begins in the Southern Hemisphere to try to develop as good of a vaccine mechanism as possible. Well, the reason that we have to keep doing that year after year after year, you're not immune once you've had influenza because of that viral change. Think of it as an enemy, if I could stay with the illustration, that continues to change and transform itself. So you think you have one thing and then you're dealing with another. With coronavirus, and I'm no Dr. Fauci, but the early indications are that it may be having some of that, I would call it genetic instability, and as a result, it may be something that continues to happen in waves. Folks, in my opinion, that's not terrible news. Doesn't mean we're going to be living this way, hunkered in the trenches for the rest of our lives. It means that we are going to potentially, I'm not sure yet, potentially in 2021, you heard it here first from Dr. Nick in San Diego, you may be getting all a buy one, get one free vaccine special, in that we may be doing influenza and coronavirus vaccinations now on an annual cycle and requiring that they be done together or perhaps as two different shots or whatever the solution is going to be. So truly the verdict is too early, Hala, to know with certainty. Dr. Fauci, I think just in the last 36 hours, made reference, if I heard correctly, to the likelihood of cyclic nature of this versus you have it and you're done for life. But that's what happens when you're in the first inning of a baseball game. I can't tell you yet what's going to happen in the bottom of the ninth.
You've answered multiple questions with I answer, actually. So I'm going to follow up, though, on one particular aspect of it, which is a lot of people seem to wonder whether if they've had symptoms, they've tested positive and are fine, they've recovered, do they now have immunity and can they go out?
Yeah, that's a good question. And again, the thing that I just answered, thank you, Hala, and thank you, by the way, these are great questions. I'm kind of getting into my medical school professor mode. I'm getting excited. Let's get it on, right? Let me share quickly something. What I was just talking about, I think, is a much longer term kind of a dynamic. I sure hope, I can't prove that yet, I sure hope that short term that people who've had the infection are, quote unquote, going to be immune, at least for a short period of time. What that period of time yet is, science hasn't yet figured out. But let me illustrate that by saying the following, because this applies to the healthcare workforce. And I always have the attitude, playfully with folks, when people ask me, oh, Dr. Nick, what are you doing or whatever? For example, Dr. Nick, are you serious about what's going on? Folks, maybe I was a little bit overly assertive because of what happened to me in 2009. I've seen this movie before. I did things with my own family before it was, quote unquote, official. My mom has not left my home, where she lives actually with me, good old-fashioned Greek-style family living. My mom has not left my home for 3 weeks, and she will not leave that home again until her son says the all clear. But here is the answer specifically to that question. If it's good enough for doctors, I think, and nurses, it's good enough for everybody. Currently, what we are doing, when we first were dealing with this, by the way, in San Diego was in a very interesting place of having received evacuees from Wuhan, some of whom, and it was just a couple of them, were infected. And we were working intimately with the CDC before they could be released from the hospital. There were all these guidelines and very specific things that you need, like 2 negative tests from different bodily fluids to test that the virus had totally cleared out. Let me tell you, as things continue to evolve, and they are interim, every day our public health officer, Dr. Wilma Wooten, reminds me, everything, Nick, we are talking about is interim guidance because it could change at any time. The current guidance with regard to that question specifically is that here is what we are deciding for healthcare workers to be able to go back on the workforce after they have been infected, that they be symptomatic free for at least 3 days. No fever, no symptoms for at least 3 days, and it's been at least 7 days, second criteria, since the infection first begun. So if that makes sense, that is the basis now that we are using. And my response, Hala, would be, hey, if it's good for me to be back taking care of sick patients as somebody who was infected, that guideline of at least 3 days of complete normal symptomatology and 7 days since the infection and the symptoms and any evidence of illness first begun, if both of those criteria are met for now, you're considered good to go. So that means in the short term that, yes, in all likelihood, you do have some immunity. Thank you.
We have a question on a tipping point for social distancing, and the question goes like this. Is there a tipping point as far as the percentage of individuals that practice social distancing? For instance, the University of Sydney in Australia released an infographic that depicted an exponential rise in cases with and without adherence to social distancing. And the infographic illustrated that at 70% compliance, there was still an exponential increase in cases, but that at 80%, it shows the trend of cases leveling off and then declining. So for them, the tipping point was 80%. How do you feel about something like that, an infographic? And in our case, in this case, the individuals asking about Los Angeles, they feel like they're seeing a lot of people not social distancing. So is there that kind of tipping point in your mind?
Yeah, again, beautiful question, and I will answer it with these few quick things. First of all, in my very passionate, non-paternalistic, non-martial law kind of perspective, folks, this crisis to me reveals that we can't always just depend on people to passively do the right thing, especially when it's an invisible enemy. And it's sad to me that to this moment in time, I don't think that people are taking the directive seriously enough. So that then brings up all kinds of secondary questions about, well, what degree do you go in terms of enforcement? Are you talking about, Dr. Nick, having, the National Guard on the streets and literally martial law and sort of a militaristic type environment? I can't be sure, but I think you're going to see that in the coming days in New York City. I'll just go out on a limb and say that. To answer what the person asked is a fascinating thing, but yet, A, I got to tell you, it's too early in the process for me to say that conclusively, but B, and this is a very important kind of quick technical thing that I have not yet touched on, but I have to because it's a key underlying premise. Modeling is only as good as the data points that you put into it, okay? And we have a major dilemma here, a major dilemma. And I'm not blaming anybody. I think, remember what I said, this is a novel virus, okay? So like in December, there was no lab test on Earth that had been developed in order to test whether or not somebody had this. But because of innovation, I have to say, boom, we've turned things around and those tests have been developed, and that is a testament to the innovative scientists that are happening and doing things in all parts of the world, by the way. There's, an all-out effort in this regard in many, many parts of the world. I don't need to name countries, U.S. obviously being one of the leaders. But here's the problem. The modeling that we have is severely compromised because we've not had enough tests. Folks, here in San Diego County, as of last night, we'll be releasing our new numbers today. We have 3.3 million people living here. We only have 297 positive tests. That, to me, is literally the itsy-bitsy tip of the iceberg of what I think is already happening. I think the iceberg under the water, and this is what you're going to see play out initially in places like New York and places like New Orleans, that iceberg is drastically increasing in size. What our goal is with social distancing is to keep the iceberg as small as possible. Models like the one that was just referenced from Australia, I think it was, are only as good as the inputs. If I was to put into a model here in San Diego, and we got to start somewhere, but if I was to put into a model in San Diego 297 cases, when in reality I had a magic wand and I was able to wave it, I can't even tell you right now if the scale's of magnitude or of what fraction. Is it 5 times, 10 times, 20 times the number of infections? I have to have those accurate numbers to put into the model in order to get those projections that you referenced of what's the right, level of NPI compliance. I can't do that truthfully, transparently on the front end because we haven't had the tests that we need and the testing capacity. Again, nothing, I'm not just giving cover to my local community, but we are ready to do some amazing things of getting our paramedics prepared to do in-home testing, the Uberization of testing, drive-through testing, destination testing, all of these categories. But if you've got the Amazon thing set up, the Amazonification of testing, but you don't have the product that you need to distribute, what good is it? So the issue that I have is, frankly, yes, these models are incredible, but the testing and the fundamental assumptions underlying them, I can't say that those are ready for prime time yet. Thank you, Hala.
Thank you. So one that's more on the focus of this maybe presentation, or when I was going back and forth with you and ASPPH on the topic, is what do we say to friends and family who are not taking this pandemic seriously, who are even sometimes living with immunocompromised individual and are continuing to not social distancing, practice social distancing?
I'm going to answer that again, personally. People, you can doubt what I say as a medical professional, but you have to believe what I do. And I have no agenda other than the health and well-being of my community. Go to my Facebook page. My personal Facebook page has nothing to do with the county. And look at the picture that I posted there. The last picture that I have with my father alive in the intensive care unit. My gloves are off and my feet are off the brake at this point, because in the eye of the storm, there is only so much time left for us to prepare. And if hearing what you have if hearing what you have already heard is not enough for you, go look at the picture. Go see the agony and the devastation. And of course, my little nephew at that time had no clue that the little cold that he had was actually an off-season, by the way, influenza bug. Normally, influenza happens in the late fall into the winter. That was one of the things about 2009 that was so serious, was that it happened totally off-season. And so for me, let me put it to you this way. Your health, it's a gift, folks. And at your age, it's not something that is easy to think about that, because you're young. You're invincible. You've got no cares in your life. Look at you right now. You don't even have to go to classes. All you do is stay at home, play video games, and watch a couple webinars and do all of your homework virtually, if I could bust a chop as a former New Jersey boy. You got it all going on. You got no problems. But you know what? Your health is a gift, and it's more than just about you. And gifts are meant to be shared. And that's why I always talk about the concept of health stewardship. Because in my opinion, and yes, it's part of my personal worldview, our health is indeed a gift, and gifts are meant to be shared. Do you love your grandfather? Do you love your grandmother? Do you love your uncle with diabetes? Do you love your nephew who has cystic fibrosis? Your dad who's got heart disease? Your cousin who's got emphysema? You're going to see them anytime over the next couple months? Stay the health at home because you love them and you want to protect them. I don't know that I can be any more clear than that. Sorry if I went New Jersey on everybody for a minute. But
actually, no, that's fantastic. But I want to go to a very specific one around what do we mean by social distancing. So there's the question around, and it comes from a public health professional that, and she says, as a public health professional, I've been trying to do my part to calm a lot of media fear that's been happening to friends and family around me. However, now I'm thinking your message is to stay at home, inside completely. Even going outside for a walk may be dangerous. Is this really the message we should be sharing? I thought getting outside for a short period of time may be okay and even advised for mental health reasons.
Got it. And I appreciate that. And let me just say, I am sitting here making certain assumptions, and please don't take this in a negative way, that there was a level set, because the message has been told over and over and over again, in my opinion, at the national level, at the local level, at the international level. Folks, there are variations, and I realize that if you live, for example, in a densely populated part of the country, and that's what's difficult about New York City. You know, if you want to go out for a walk, you got to go down the hallway, you got to get on an elevator, you got to go down the stairs, you got to go through a corridor, and that ability to maintain a 6-foot, quote unquote, social distance may be impossible. But by social distancing, what we are talking about, and there's also variation, by the way, to the dramatic nature of it. Not all of the country is even under the place that we were, or that we are. Just to illustrate it quickly, a lot of this relates to, for example, mass gatherings. We started with our guidance, mass gatherings at 250 people, quickly took it down to 50. We now have it down to 10. We literally have some parts of the world who are like mass gatherings or 2 or more out of the question. So what that means is that people should not be congregating, and they should be maintaining at least a 6-foot distance. Now, I live in a home that has a little yard. I have 2 daughters and my mother. I'm a single father with custody of my daughters. My mother is the one who helps me take care of them. They go outside. They do whatever they want to do in my yard. But I'm not taking them to the park like we normally do for them to go skating or rollerblading or whatever. Because what's the likelihood there? There's no way to guarantee that you're not going to come within 6 feet of somebody. So to me, the general guideline that I have, and some of my staff, even walking in here today, I kind of feel rude. I'm like, step back. I'm not used to that. I'm a lover, not a step back kind of guy. Give me a hug. How you doing? What's happening? It is imperative for people other than your immediate circle and your family, which hopefully you are in contact with on a daily basis, to be able to maintain that 6-foot distance and to avoid contact with humanity outside of your dwelling place in order to maintain that as well. One of the biggest challenges, by the way, quickly, that we're facing here in San Diego, which is true for many parts of the country, but I think San Diego is leading the pack in the sense that we are doing some amazing things, folks. I don't have time to get into them right now, because this issue, we're all making an assumption in this little webinar, we all have a roof under our head. What does this mean for the homeless? What does this mean for the people who are living, you know, in all the different environments that don't have stable housing? So the social distancing concept, forgive me if it was not uberly clear. Yes, you should absolutely be staying in your home as much as physically feasible. There are some parts of the country where that's still not happening. There are parts of the country that have that guidance in place. Think of that illustration I gave of staying in the trench. Stay in the trench. Every time you leave the trench, you're suspect to getting hit by crossfire. And that crossfire could be a clerk. It could be somebody on an elevator. That's the whole thing. And once the community transmission, and by the way, that's what's happening in New York, the launch of the EpiCurve in New Orleans, in Seattle, in San Francisco in the coming days. The launch of the EpiCurve is when the infectious rate has been so widespread that that community transmission is much more likely to happen. The best time to stay hunkered down and stay in your trenches and protect yourself is when there's not as many bullets flying around. So I hope that makes sense. But yes, Hala, it has to be customized, and there are variations, and there is not a universally standard definition. An important reminder, policy, often at the national and state level, implementation and operationalization at the local level is at the county or city or whatever the defined jurisdiction is. For us in San Diego County, it's my colleague, the public health officer, Dr. Wilma Wooten, who ultimately pens the directives, and then all of the compliance and so forth needs to happen. What that looks like in New York versus New Orleans largely makes a difference. The reason to be so aggressive now is that because of the incubation period, I hope you all remember what incubation period is, the time from when you get infected to showing symptoms, it can be as long as 14 days. Literally, you could be walking around for over 8, 9, 10, 11, 12 days. Maybe it's even 15 days. We don't know exactly. We're saying at least 14 days, spreading the love of this virus without even being aware of it. That's the whole principle, and that's what makes this so monumentally different for us and a once-in-a-lifetime experience for all of you and me that we've never been through this before as a nation and as a global community as well.
So you touched a tiny bit on this, but I want to take us back to it is the policy. So one of the questions that's coming through multiple times from our attendees is, do you think we've taken too long to put forward policies around social distancing and gathering, not just in San Diego, but broadly in the US? Has the policy aspect been delayed and has an impact on where we are today?
Hala, playfully, because you know I talk too much, I'm going to answer that question very simply. Yes.
Thank you. So another one that I think our attendees are definitely interested in hearing is healthcare workers. How do we support them right now? How do we protect them? Is there anything that whether it is our attendees that can do from remotely in supporting, or whether it is those who have parents who they're worried about, who are physicians, who are still going in, or themselves are healthcare workers? What's the message there?
Hold on one second. Jennifer, is Jocelyn here by any chance? Jocelyn, do you by any chance have that thing that I asked you to print earlier today, the testimonial? And if not, if you have it, I want to read something. This is very spontaneous. I'm going to read something to you guys. Thank you. See how amazing people are? I just ask for something and it appears. That's the team that I'm blessed to be a part of. Hala, tonight we have and I know we have about, 4 or 5 minutes left, but this is powerful. We have we're doing a virtual town hall. I'm going to be facilitating a meeting tonight. We did it last week. We're going to do it. This is part of what we do in San Diego. We call it Live Well San Diego, with a focus on keeping our communities healthy, safe, and thriving. If truth is truth, it applies in all circumstances, as well as in crisis, by the way. So we're having a very interesting, similar to this webinar, but I'm not going to be the only one. I'm going to be joined by 5 of the top leaders in this area out of here in San Diego. And I'm prepared. I know this doc personally. He'll be fine with what I'm about to do. I'm going to read a testimony for you of the first physician who was infected with COVID virus here in San Diego. And I think it's very telling, and I'm going to take a couple moments to read it. It's less than a full page, so bear with me. This is a medical colleague who has given me permission to share his story, obviously without any of his own personal identifying information. Nick, when I first noticed the symptoms, I assumed that allergies were flaring up as they do this time of year. I had increased nasal congestion and a very mild cough with chest tightness for about 4 days. Usually with a viral symptom, I would have expected progression to worsen to cough, pharyngitis, or that general feeling of being ill. It's interesting, that really didn't happen this time. However, on day 5, I began to develop massive muscle aches, weaknesses, and a sore throat. Shortly thereafter, I developed fever and chills as well. I treated myself with NyQuil and I went to bed. When I woke up, I was sweaty and still having a fever. Ultimately, I called into work at this point and made the department aware, as I was supposed to cover the overnight shift. Together, we agreed that I would get tested. Over the next 2 to 3 days, the symptoms resolved. The day after I had the fever, symptoms were again very mild, including congestion, pharyngitis, and a mild cough. I never even noticed shortness of breath or loss of smell or taste. My cough was dry and accompanied by some chest congestion, tightness. I counted myself lucky to be what is the likely majority with a very mild disease course. It may be helpful to know that I'm in my early 30s and I am a male who has no comorbidities. Honestly, we are not in a profession where it is acceptable to call in sick. We are conditioned as early as medical school that you work through illness. Perhaps the most difficult part of the whole thing for me has been the guilt. Initially, I felt like I was letting people down or would be perceived as lazy for calling in sick. It actually took 6 days to get my results back. Through that whole time, I felt so guilty for leaving my department short for what I was sure was simply a URI, upper respiratory infection, or a flu. When I got the positive test result, then there was almost a massive sense of relief in that my absence was justified. However, then the guilt set in for not calling out sooner. I worked shifts and spent time and loved ones during the extremely mild part of my cough and congestion that I was having. I likely exposed several others to the virus. Nick, these are very unique times. They have changed, and even with mild symptoms, testing should be done for all of us taking care of patients directly, and the time taken off while those results are pending. Folks, what's interesting about healthcare providers, by the way, and I know him personally and we've talked, I think it is very likely that he did not get this infection in the healthcare setting. But there is a lot of energy around that right now with nursing unions and other groups, and it's exacerbated by, frankly, a very appropriate concern about the level of personal protective equipment that we have. But I just want to remind you, and going back to what we talked about before, and the criteria by which this doctor, by the way, is going back to work today, which is a great thing. It's what I talked about before, 3 days of total asymptomatic reality, and then it's been over 7 days since he initially developed the first symptoms. So this healthcare worker issue is a big one. And one of the groups, there are others, people who are very sick in the hospital, people who are in congregate care settings like skilled nursing facilities and so forth, but testing healthcare workers so that we can accurately know whether from their personal work life or potentially for some in the occupational setting, if they're infected, they're our frontline people and we got to protect them, and we're testing them promptly, and they are high priority. Not because of their value of life, but because of the frontline service that they are providing to our community.
Dr. Nick, thank you so much. We didn't even scratch the surface of the questions we received today, but with a lot of them, there were direct messages to you to thank you for your time. And I want to thank you personally for sharing your expertise and all the attention and thoughtful questions we received from the audience today. A recording of this will be available shortly on ASPPH and its website. And I also want to point out that as you close out of this session, please take a moment to complete a very brief survey. Zoom will display this in your web browser. And finally, displayed now on your screen is the upcoming virtual annual meeting sessions. You can learn more about these on the ASPPH's website. This concludes our webinar today. Thank you all for joining us, and thank you again, Dr. Neek, for all your time during this particularly busy time. We appreciate it.
You're welcome, Hala. Thank you all. Appreciate you very much as well. Bye-bye.